The first permanent molar erupts into the oral cavity at the age of 6 to 7 years. It is the eldest tooth in the mouth and therefore is exposed to the oral environment for a longer period of time. The deep pits and fissures of the molars make them more vulnerable to dental caries. Application of fissure sealants along the pits and fissures will form a physical barrier between the oral environment and the occlusal surface of the tooth. Therefore, fissure sealant therapy is considered as a minimum invasive procedure which prevents and controls dental caries. This video provides a practice guideline for the application of fissure sealant in the school oral health program in Sri Lanka.
Fully erupted first permanent molar teeth with deep pits and fissures should be sealed. Fissure sealant should not be applied on the first permanent molar teeth with following features: occlusal caries, existing restorations, signs of proximal caries, isolation not possible. All food debris should be removed from the occlusal surface with a moist cotton pellet. If there is gross debris, such as calculus, refer the child to the nearest government dental clinic. Polish the occlusal surface using pumice applied with a polishing brush in a micromotor handpiece. Use a minimal required amount of pumice. Rinse the occlusal surface using a chip syringe and wipe with a moist cotton pellet to remove any remaining pumice. Isolate and dry the tooth surface. For better retention, proper and adequate isolation is mandatory. Properly block the submandibular, sublingual and parotid salivary gland duct openings. Following the manufacturer's instructions, apply dentine conditioner on the pits and fissures to be sealed with a microbrush and wait for 20 seconds. This will remove the smear layer. Wash the tooth with water using a chip syringe. Dry the tooth with cotton wool and isolate the tooth as mentioned in the previous step. Mix the sealant according to the manufacturer's instructions. Dispense 1 level yellow scoop of powder with 1 drop liquid onto the mixing pad. 1 level yellow scoop of powder would be sufficient to seal 2 molar teeth. Dispense the amount according to the number of teeth to be sealed in order to minimize wastage. Spread the liquid over the pad. Mix the first portion of powder with liquid for 10 seconds. Incorporate the remaining portion and mix for 10 to 15 seconds. Total working time for 1 level yellow scoop would be 1 to 2 minutes. Sealant material should be applied using a plastic filling instrument without incorporating air bubbles. The material should be distributed uniformly and smoothly into the fissures and then remove excess material using the plastic filling instrument. Apply Vaseline on the sealant material after removing the excess. Check for high points visually and tactically and ask patients to bite and feel for high points. If occlusal high points are present, correct them. Instructions are to be given to the parents or the caregivers after fissure sealant application.